Hey everyone, I'm Sarah Lavonne and welcome back to my YouTube channel. We're back for another Coffee and Questions where I answer your questions both from YouTube comments and then from Instagram. Today we're gonna talk about epidurals not working. We're gonna talk about if you have a history of trauma or sexual abuse in your past and how to avoid your triggers. Briefly, although that one definitely deserves its own video. We're gonna talk about using a birth ball. I have my list here, thank goodness, because I always forget and I can never remember. What your other options are for vaginal pain if you tear or while pushing, if you need some sort of pain relief. There's a sneaky one that I threw in there. We talk about connecting with your care team, what to do if you have somebody that's like not working with you and making labor noises, and then what to do with your pubes. So with that, make sure you subscribe down below and then give it a like, share with a friend, and then let's get answering all your questions. I'm gonna start with your questions from Instagram and the poll that I threw up over on the Bundlebirth Instagram. So if you don't follow me on Bundlebirth, make sure you do. This comes from Lila Mendez. She says, when beginning to push, can you ask for that numbing shot on the vag so you don't feel pain? Great question. So if you don't have an epidural and you're feeling the contractions, you can ask for anything, really. You have all the right to have this discussion with your provider. Two different types of numbing shot options. One would be a basic lidocaine, so like what they use to maybe numb your mouth for a cavity, for numbing medication that they inject into the skin at the bottom of the vagina hole, between the vagina hole and the butthole, called your perineum. That space is typically, if you are gonna tear, that's where it's gonna tear. You can watch all about my tearing video because I do have an entire video on this. But they may inject some local medication there in order to help with the discomfort. Now, they're not usually gonna do that though until after you give birth, if there's a repair that's needed, meaning they need to suture or stitch you up a little bit. So you could talk to your provider about that. Now, mind you, most of the time at that point, if you're feeling any discomfort on your vagina hole, like it's not necessarily gonna make that much of a difference. Plus, when the head is stretching the vagina hole so much, there's not as much blood flow, meaning there's not as much sensation to your vagina hole. It may feel burny, it may feel stingy, but past that, it's not the same as if you were to like go down there and like tear your own vagina right now, which I don't know why you would do that. Please don't do that. But it is a different sensation. Now, the other option to discuss with your provider, maybe you don't have an epidural as an option, say you have a bleeding disorder or something that rules you out from having an epidural, or you choose not to have an epidural. There is such a thing as what's called a pudendal block, where basically your OB, your obstetrician, injects medication or anesthetic into the pudendal nerve, which numbs just the like very bottom part of your vagina. And that can help when you're in that pushing phase. If you're having a ton of discomfort, you can't sit up for an epidural, but you need some sort of pain relief, you could talk to your provider about that. Now, what I will say about a pudendal block is if you're an OB, you're probably watching this like, oh man, she talked about it, because it is so uncommon and it's kind of like more of an old school practice to use. It would mostly be used in the case of like maybe an intense repair. Maybe you had a very large tear to through your vagina if you don't have any kind of anesthetic. So talk to your provider about it. Honestly, if at that point you're needing pain relief, you are so close to this baby coming out, take a deep breath, push this baby out, slow and controlled, watch my vaginal tearing video, and you're good to go. Jessica Canny Colehart says, should you still be counting your baby's kicks during labor? I love this. So yes, you should. Now, realistically speaking, are you sitting there like through a contraction like, oh, ow, there's 1, 2? No, not at all. The key during labor when you're at home is for you to be aware that your baby is still moving. Now, during a contraction, please, this should be the last thing on your mind. You should be coping and breathing and doing what you want. But between contractions, that's when you do want to be mindful that every so often, I'm gonna say every hour or so, you're feeling for that movement. You don't necessarily need to count to 10 every single hour, But you know, like, can I feel baby move? Maybe you don't between that contraction. Next contraction comes, hoo-ha. Next time between contractions, you're counting to see if you can kind of feel any movement. Now, if you're in labor and you don't feel movement, you can try ice water, you can try juice, you can try changing positions, walking around. Sometimes you can get your baby to move. Give it about an hour, 2 hours max, but if you're not feeling your baby move and really you're doing all those things and you feel nothing, it would be an indication to still go to the hospital. That's one of the main questions I get when I'm laboring at home with clients of like, how do you know that my baby's okay? And as long as baby's moving, we assume that baby's okay because the studies show that that is true, that as long as we have fetal movement, that things are usually good. But if I'm asking throughout labor and I do, have you felt the baby move recently? Or, you know, or sometimes I'm with clients and I can literally see their belly like, and I'm like, oh, well, baby's moving. So long as I know baby's moving, we're good to go. But if it's been a while, we're gonna try to maintain that like awareness of the baby moving through labor. Short answer, yes, you should. Maybe not count them, but like be aware of your baby moving during labor. Leela Croy says, is there a bad time to start using a birth ball? So a birth ball is just a fancy word for an exercise ball. Any of those round, big yoga balls that you sit and bounce on. You can do big hip circles, side to sides. I actually have a birth ball guide in my store that you can purchase if you want. Everything's in the description box down below. There really isn't too early a time. There is no harm done unless your provider, your doctor, your midwife says, no, I don't want you on a birth ball. You're maybe on bed rest, you're in the hospital or something, then yes, of course, like listen to your doctor. For anybody, whether you're pregnant or not, exercise balls or these birth balls are great for keeping that motion in your hips, loosening things up. Our fascia, which is an organ system in our body that is both equally liquid and solid, it keeps us fluid, it helps us stretch. If we sit for too long, it starts to crystallize. And that crystallization, that's when you get out of bed and you're like, oh, hold on, I have a kink in my neck. I gotta like, work it out. That if you can kind of keep things motion, that's why I say motion is lotion. If you can keep things moving, that keeps your fascia nice and loose. And a birth ball is a great way for that, to strengthen your core, strengthen your pelvic floor, strengthen your back in a very subtle way, and then keep that movement. It's just good for overall life. So there is no too early to start using your birth ball. Just get one and use it. It's a great tool for your pregnancy, your labor and your birth, and then for postpartum for bouncing your baby. So I so appreciate your questions about any kind of mental health stuff or trauma triggers. Trauma in general is a huge passion of mine. So we'll go there a little bit, but this probably deserves its own video. So if you want it, let me know in the comment box down below. So I'm not actually gonna name the name here, but you know who you are, just out of confidentiality. She says, how do I work with my care team to create a space that won't trigger me when I give birth? She has PTSD after childhood sexual abuse. I also have a question that says, how can I cope with birth trauma after an unplanned C-section? I want to heal before trying. Another person says, a difference between baby blues and postpartum depression, which by the way, I have an entire video on that, so make sure you check that out. So any of this stuff, like especially a space that won't trigger you. I love and appreciate this question because you should be thinking about this. If you have a history of childhood sexual abuse, sexual assault, any kind of abuse, domestic violence in your past, it is possible, we see it, we know the studies are pretty clear that some women are re-triggered by certain things in the hospital. Now, mind you, that doesn't have to be childhood sexual abuse. That could just be a trauma you had in your life, and maybe the smell of the soap or something triggers you. It could be really a slew of things. What I encourage you to do is consider in a safe way, so long as it's not going to be re-triggering for you and send you spiraling, to either work with a trauma therapist or your therapist who you've seen, or if you feel safe enough to consider what might be those things that could trigger you into feeling traumatized, I'm gonna say, or having some sort of like stressful scenario that could be traumatic for you or re-traumatizing you through that experience. So to think about, is there a certain position of you like sitting in, if maybe on all fours, that's not okay for you, or not having consent before a vaginal exam, which to me is just a standard of care. But let's be honest, like sometimes you're gonna have to like make it very clear with your provider. If I say stop, stop is stop, no is no. And so having those clear, open lines of communication about what your expectations are and then knowing your triggers is so incredibly helpful for your care team. And hopefully you get a bundle birth nurse who's following our mentorship and who's following us on social media. If you're a nurse, please follow bundle birth nurses because we're giving you some extra information and support over there that is going to provide you with an environment that gives you that autonomy over your body, that's going to be very aware of what it means to be trauma informed, ask you about your triggers, or you share your triggers and they're going to go, okay, I hear you. Let's do what we can to avoid any of those triggers. And there are lots of things, but even just creating an environment that your care team is aware of and being proactive about that is going to be really helpful. And hopefully, again, like I don't know who your nurse is going to be and I don't know like what their training is in trauma, but in general that they can receive that information and really nurture it with love and care and say, I got you here. We'll do everything we can. And like, or say like, we will never get you in all fours. We will never. I'll make a note here. We'll pass it along to all your care team. Just let it go. We're never going to ask you to get on all fours. And then you can just let it go. So doing some of that to prep ahead of time, identify what those triggers could be, and then share those with your care team and help that like loop them into the fact all about that. They don't need to know about your trauma history. You can just say, I have a history. I have reason for this. They don't need to know your whole life story, but they need to know what your triggers are. So that's my rant on that. Again, whole video. I could talk about this stuff forever. In fact, I'm kind of in the middle of a whole potential educator training on this. More to come when I can talk more about it. But I would say identify your triggers ahead of time. Now, for somebody who's had a traumatic birth, you got to talk to someone and you got to do some birth processing, whether that be through me. I'm not a therapist, but I'm a great listener and I can always provide perspective and a listening ear and help encourage you for next steps potentially. And all of that's on my website. You can do that. Otherwise, finding a perinatal psychologist with a history of some sort of trauma training, maybe EMDR, is going to be really helpful for you if you felt like you had a traumatic experience to help work through that memory prior to this next birth. Because the worst case scenario is everything's going differently, but because you're still in the same environment, because you have unresolved trauma, that you're re-triggered through that experience and you can't even enjoy this second birth. We want you to have the happiest days of your life, and there are ways to get through that, even if you've had traumatic life experiences or a traumatic birth experience, but it will require a little bit of work and putting in the time and the effort to kind of get you to a place to regulate your nervous system, do some prep for your next birth, and then kind of close that chapter as much as possible to open up the whole new world of how things can be different. Carrie Hawkins 890 says, do nurses care if you shave down there? Whatever you do down there is totally up to you. None of us care. I promise you, I have seen every variation of what can happen down there, and I couldn't remember what it looked like with the last client that I delivered. They're all one big vagina blur and we don't care. Okay, so you do whatever you want. If you want to wax, shave, let it just go free, then do whatever makes you feel more comfortable. Oh, along those same lines, Amanda Jacobson says, this is my 4th pregnancy and I'm 30 weeks pregnant. I find myself more anxious about labor and delivery than I was with my previous babies. How do I clear my head of the anxiety? I'm worried that if I don't, it could negatively impact the birth. That's so true. Again, same thing. Find somebody to do a birth processing session with or birth debrief. I'll link the resources that I have down below because I do have a directory of people that have some sort of realm of wherewithal and know-how in this. I myself do it if I have an opening. So talk about it and work it through. And I love that you guys are asking those questions because it will help set you up for that positive birth memory. Faye Austin says, question, my epidural didn't work in my last birth and I had a large window of pain. They tried to redo it, but it still didn't work. I was never told why it happened. Will it happen again next time? My answer is flex and flow on this one. Could it? Yes, but most of the time, it is possible that with an epidural, you have like one, we call it a window, and there's different windows, but like an epidural window of like, say, I just have pain in like this area of my belly or right down here. Sometimes for whatever reason, the anesthesia doesn't travel and flood the nerves to everywhere, and there may have been an area that didn't get flooded. So is it gonna happen again? Nope. Not necessarily. I've had people that had windows with their first, and with their second, they had a fully functional, perfect epidural. And I actually can't think of anyone that had a window and then didn't, and then had the exact same window the next time. So I don't totally understand the pathophysiology of it. If you're an anesthesiologist, please let me know. But I would say in general, expect it's a new slate, new birth, new experience, and to flex and flow based on what happened, but in general, not to stress about it because it's a whole new scenario this time around. Jessica Crane, how can you make sure your hips are open for birth if you are struggling with pubic symphysis pain and have to avoid things like squats? Will this affect labor and delivery? This is such a good question because I think all of us hear these things that like we have to open the hips, we have to create space. Your body naturally creates space for your baby, okay? You have this hormone in your body called relaxin that softens out all the cartilage in your joints everywhere, including your pubic symphysis, including your SI joints in the back, that allows for a lot more mobility and movement in the pelvis to help accommodate the baby. The other thing is it's not just about opening your hips. And in fact, there is some movement with the pelvis where if you do certain things, it kind of opens the top, then it locks the baby in and opens the bottom. This is my entire physiologic birth training that I do for nurses. And actually, by the way, I do have my position guide for sale now on my website, which I will link down below, that helps you to know what positions to try to open different parts of the pelvis based on where the baby's at. And you can just ask your nurse, where's the baby at? And then look at your sheet and do the position that works for you. But there's lots of ways that like you don't actually have to open the pubic symphysis. And if you can't squat, rule of thumb for any positions in labor, hear me out, is do not do anything that hurts. If it feels horrible, then don't do it. And if you can only lay with your legs parallel and maybe your knees a little wider than your feet or something, like do that, right? But you don't have to go into a full squat to be able to birth your baby. There are people that literally lay there and the baby just slips right out, okay? Now, mind you, it's easier, probably faster if you are being a little more strategic with it, which is why I have a position guide. But it really, like, even with pubic symphysis pain, I've had people that have had that and there's certain limitations that they have for labor. It can be really uncomfortable, but it also doesn't mean that the baby can't fit or that they can't manage labor. It's just about finding the position that works for you, that feels better based on the sensations that you have. This is so good. And this is for nurses and for patients, okay? Aylin004 says, hey, second baby on board, she's 17 weeks. How should you best handle interpersonally your labor team being unsure or not very supportive of your decision to labor and birth unmedicated, meaning without an epidural, just going for it? I not only got weird looks the first time, but I heard comments about me being loud, moaning during contractions in hard labor. Should I just ignore it this time? This feeds my soul. Okay, so first of all, I am so sorry that you felt talked about behind your back. It's not okay if you're a nurse listening to this. We need to really watch our mouths about how we talk about patients, especially at the nurse's station where they can hear. I had a patient recently this last week who called the call light and they left this intercom off and heard everything that was said about her and other patients. So nurses, let's be really careful and let's also just be mindful of what the impact is when we have a negative attitude towards somebody. That's just like a life skill, whether you're a nurse or not, but we'll go with it. So yes, you should ignore it this time. That's an easy answer. But as far as best handling a labor team, like especially if you don't want to go or you want to labor without an epidural, whatever sound you make is the sound you make. And if you are coping, you can make as much noise as you need to. A lot of times sound and vibration and like especially lower sound can be very helpful for coping. And so for me, hear me now, if you make noise in labor, no one should care. And really, unfortunately, sometimes in the medical system, we're not used to seeing patients that don't have an epidural. It can be uncomfortable. Labor can be a little wild and a little like, rah, like very like weird from an outsider's perspective. Not every day are people like moaning and groaning and growling through their life. So you're like, what's happening here? But in general, I'm gonna challenge the medical system to be more open and be okay so long as they're coping, not suffering. And sometimes that coping may look like loud moaning noises. Close the door. But in labor, you have a free pass. If you need to moan, groan, yell, scream, so long as it's not screaming because your anxiety or you're like, I'm like feeling overwhelmed to a negative side where you're not coping, that's a different story. But if you're coping and needing to make noise, then make all the noise that you need to make. And if you're a medical person and you feel uncomfortable with it, that's one reason why we have an entire coping with labor class for nurses and mentorship. But the idea is we have to start to get comfortable with whatever the expression of pain is. And in knowing that in labor, people make noise, you move around, you do weird things, and it's a good story later. So let it all go. And then if you're having an issue, honestly, if you're like hard laboring or something, you're not probably gonna have an interpersonal conversation to heart with your nurse about it, but also even just to say, look, you're coming in earlier, I plan to go without an epidural, I know I make a lot of noise, does that make you feel uncomfortable? And just put your nurse on the spot about it is what I would do. And then if they're like, oh no, you know, whatever, just say, I felt like people were talking about me last time. And for you need to feel the freedom for your hormones to work for labor, to express yourself however, and be fully free and fully vulnerable throughout your labor. And so one, there may be a block off, but there may also be requesting a nurse that feels more comfortable, because sometimes units will handpick nurses that do kind of like that patient assignment. And then just putting them on the spot. Does it make you feel uncomfortable? I don't want to make you feel uncomfortable, but I need the freedom to know that you're not talking about me behind my back, or that you can, you know, even if you are uncomfortable, that it's not going to become an issue with us because you're laboring. Like, you're doing an amazing thing. And especially if you don't have an epidural, but even if you do have an epidural, labor is hard, right? So that's my 2 cents about it. I hope that helps, but it sounds like you did a really amazing job, and I'm sorry that your medical team made you feel uncomfortable with the noises that you're making. I've heard it all. I've been yelled at personally, and one of my rules of thumb, especially for support people, and watch my support people video, one that I have about this is that you get a free pass. That if you need to yell, scream, whatever, you cuss, you know, say something that sounds aggressive, like no one's ever gonna take it outside that room. You need to be able to be the freest person in the entire world through your labor. I think that's it for today. I'm trying to make these a little bit more shorter and sweet, but if you don't follow me on Instagram, make sure you head on over to Instagram, follow me at Bundle Birth over there. Feel free to hit up the description box down below. I have a bunch of online classes. I have a whole lot of other things going on my website. If you're a nurse, we have lots of programs for you. And then also to keep in mind that we do have my positioning, my like laminated hard copy position guide that is for sale, that if you want to purchase that, I'll link that down below as well. If you have any other questions for me, you can put those in the comment box down below. I do scroll to these videos when we're looking for questions for next month's Coffee and Questions. Make sure you subscribe down below so you never miss a future video, and then you don't miss me potentially answering your question in a future Coffee and Questions. And then until next time, don't forget to flex and flow, and I will see you soon. Bye. So I'm gonna start with Instagram. Do I have something in my tooth? Who cares? Uh-oh. Healthy baby, healthy birth memory. What you should do down there with shaving, waxing your pubes. I feel like my eyelids are really droopy. Jess, okay. Been doing a lot of horse lips recently. I think it means that I'm stressed.